Hello and welcome to Better Living, where we take a holistic approach on what it means to live better. We talk about the intersections of our physical, social, emotional, and spiritual domains, and how a healthy awareness of each one can strengthen our joys and reduce the negative impact of our sorrows. I'm Dr. Neil Ritchie, and it's my pleasure to be your host for this weekly podcast. Thank you for joining in for this week's discussion. Hello, and thank you for joining me on the podcast today. I'm Dr. Neil Ritchie, just thrilled to have you on board. As you know, this podcast exists to increase awareness related to mental health related illnesses, and it is to decrease the stigma that's sometimes associated to mental health disorder. And so what we're hoping to do all of this month, which is Mental Health Awareness Month, is to enlighten perhaps viewers, listeners, whether you're watching the YouTube video or listening to the podcast. But it's just to enlighten folks to some of the major mental health disorders that folks face. And so today, what we want to discuss is we want to discuss psychosis. Now, we've been talking more about neurosis, but today it's psychosis. And as we discuss this matter, I think you'll begin to see the difference between the two types of mental health related illnesses. Back in the 1990s, in fact, 1999 to be exact, one of the most popular lines in among moviegoers is the line that said, let's see, how did it go? I see dead people. You remember it, don't you? That phrase was from the film The Sixth Sense, and that film starred Bruce Willis and Joel Osment. And without giving too much information away, just in case you haven't seen the movie and would like to, Osment played the role of a child who could see and hear the dead. Willis's character was a child psychologist who worked with Osment. Hallucination, sensory experience, which was the case of Osment's character, those are some of the symptoms of psychosis. Psychosis is probably one of the most frightening, or I shouldn't say it that way. Psychosis, to some, may be much more frightening of an experience than neurosis. And the reason I say that is because psychosis leads to all types of cognitive, affective, or mood, behavioral, and relational problems. Now, that's not to say that neuroses does not yield some of the same related issues, but psychosis, most definitely within some, it is increased many times over. So where does psychosis come from? Let's think about it in similar fashion as we have with neuroses like depression and anxiety, panic, and so forth. So let's think about it from an etiology perspective, meaning an origin perspective. So if we think about psychotic disorders, known as schizophrenia spectrum and other psychotic disorders, both of them have internal and external factors, endogenous, internal, exogenous, external factors. So let's think about it from an internal standpoint first. Genetics and biology may certainly lead to psychosis. There can be a family history of psychotic disorders. There may be a pregnancy at birth complication that impacts brain chemistry, which could have resulted in a psychotic disorder. Studies have shown that a number of things lead to psychosis, whether it be Addison's disease, brain dementia, central nervous system infections, Cushing's disease, delirium, dementia, all of these can potentially lead to psychosis. There's also encephalitis, um, internal factors. There's herpes, AIDS, neurosyphilis, and so forth. There's systemic lupus, uh, uh, epilepsy. There's Huntington's disease. There's hypothyroidism, hyperthyroidism, I'll get it right, hyper and hypothyroidism that can potentially lead to some psychosis. There is multiple sclerosis. Uh, there is pregnancy, postpartum, hormonal changes that can lead to psychosis potentially. There's brain injury, vitamin deficiency, Wilson's disease, and the list goes on and on. I'm just trying to give you some of the endogenous related issues that can, not to say that they will, but they can potentially, at least there's some evidence that suggests that psychosis can result in some patients who have experienced these uh, uh, internal factors. But what about from an external standpoint? Well, social and environmental factors most certainly have been noted to cause certain forms of psychosis. Additionally, there are a number of medications and other substances that can contribute to psychosis. In fact, according to one source that I had read, psychoactive substances may include alcohol. It can include antihistamines. It can include anti-Parkinson's medications. It can even include appetite suppressants, certainly barbiturates, um, beta blockers, corticosteroids, and other hormones potentially can contribute to, from an external standpoint, can contribute to psychosis. Uh, Environmental toxins have been known to contribute to psychosis. Uh, Things like heavy metals, volatile hydrocarbons have contributed to psychosis. Also, psychostimulant medications like dextroamphetamines, uh, tricyclic antidepressants or TCAs, they've been known to contribute to psychosis. One of the consistent features in the etiology of psychosis is the increased activity of the neurotransmitter dopamine and the glutamate levels in the limbic system pathway. So those are consistent features in the history of those that experience psychosis. Well, what about the symptoms? What are some of the symptoms of psychosis? There, according to the DSM, there are both, and when I say DSM, you may not know what that is. It's a Diagnostic Statistical Manual of Mental Health Related Disorders. The DSM-5, there's the recently released DSM-5 update. But according to the DSM, there are positive psychotic symptoms and there are negative psychotic symptoms. And you may be saying, well, it sounds like it should be just all negative symptoms. Well, here's what I mean by positive psychotic symptoms. Delusions, hallucinations, disorganized thinking or speech, grossly disorganized or abnormal motor behavior, which can include catatonia. Um, uh, the negative symptoms, unlike the positive symptoms, negative symptoms, what I mean by that is negative symptoms represent something that is deficient, okay? Something that's lacking. So maybe there's a lack of apathy, there's blunted affect or mood or motivation. There is poverty of speech or lacking in speech. There's poverty of thought content. There is asociality. There's ambivalence, poor hygiene, and a number of other negative or things that are lacking psychotic symptoms. Um, when I was researching for the podcast today, I noticed that some Mayo Clinic staff writers said that symptoms can vary in type and severity over time with periods of worsening and remission of symptoms. And so just because you experience these positive or negative symptoms today doesn't mean you will always experience them if you in fact have a psychotic disorder. Some symptoms may always be present, even though they may not be at the same level. For instance, in men, schizophrenia symptoms typically begin in the mid-20s, and women's symptoms typically begin in the late 20s, and sometimes that symptomology changes over time. Well, how do you diagnose it? How do you diagnose someone that has a psychosis-related disorder? The DSM states that schizophrenia spectrum and other psychotic disorders, which include schizophrenia, schizotypal personality disorder, they have multiple criteria that have to be met in order to be diagnosed positively with a specific psychosis disorder, such as delusional disorder. So with delusional disorder, a patient is required to have had at least one delusion lasting for an entire month or longer. And if hallucinations are present, they are related to the delusional theme. Patient functioning is not markedly impaired. Those would be criteria for a delusional disorder. Now, a brief psychotic disorder is a little different, and in that disorder, a patient has to have either a delusion or hallucination or a period of disorganized speech or catatonic behavior lasting for at least a day and less than a month. And the behavior is not going to be better identified as major depressive or bipolar or some other psychotic related disorder. There is another psychosis disorder called schizophreniform disorder. And within schizophreniform disorder, the patient must have more of the positive or negative symptoms that I've just mentioned lasting for a month and less than 6 months. So then in that case, what we're looking at is symptoms have to include either delusions or hallucinations or disorganized speech. Schizoaffective, depressive, or bipolar disorder with psychotic features have got to be ruled out. Okay. Now, schizophrenia, that's one that probably we're most familiar with from a standpoint of psychosis-related disorders. In schizophrenia, a patient has to have 2 or more of the positive or negative symptoms that I mentioned earlier, and they have to have lasted for at least a month and less than 6 months. And the symptoms have to include either delusions, hallucinations, or disorganized speech. There must be significant impairment in functioning and interpersonal relationships as well. Now, there are other psychotic disorders such as schizotypal personality disorder, schizoaffective personality disorder, substance and medication-induced psychotic disorder, and psychotic disorder due to other medication conditions. And if you want more information, you can hit the Google machine on those. Well, how do you treat it? How do you treat psychosis? How do you treat schizophrenia spectrum and other psychotic disorders? Well, treating them certainly has their challenges, but psychosis is treatable. It's important to have a good treatment team, though. Just like with any other mental health illness, you have to have a good treatment team that can work alongside the patient in their process, and it is a lifelong process. So what should the treatment team consist of? Well, the treatment team most certainly needs to consist of a medical doctor for a physical exam. There needs to be imaging in order to rule out a physical condition. You need a psychologist as part of your treatment plan, a psychotherapist who can perform a mental health evaluation. Psychologists can perform a detailed mental health evaluation. A psychiatrist needs to be part of that treatment plan. A psychiatrist can manage the antipsychotropic medication, or I should say the antipsychotic medication that will be prescribed to help treat the psychotic disorder. And also, a psychiatrist is going to have greater insight into the effectiveness of medication, which will most certainly be a mainstay of the treatment plan. Unlike neuroses like depression and anxiety and others, where you may be able to treat with solid talk therapy from a psychotherapist or counselor, with psychosis related disorders, medication is most certainly a mainstay to treatment. Now, research suggests that patients with a psychotic disorder have elevated levels of dopamine, and antipsychotics can help to block certain postsynaptic, which that's a part of that transmission process of neuron to neuron by way of the neurotransmitters, which we've talked about in previous episodes. But those antipsychotics help to block postsynaptic dopamine receptors, thereby sort of bringing the brain to the table so there can be a greater sense of changed behavior, increased affect or mood, and so on. So since antipsychotic medication can impact other neurotransmitter symptoms, it's important to monitor a patient for negative side effects. Some of the antipsychotics that a psychiatrist might prescribe include conventional agents, Thorazine, Haldol, Stelzine. Those are just some of the conventional ones that could be used, but it also may include atypical agents, Clozaril, risperidol, Invega, Abilify, just to name, Seroquel, just to name a few. It's really important, and I can't overstate this, it's really important that you work with, if you're experiencing a psychosis-related disorder, it's really important that you work with your mental health professional and your physician to develop the best treatment plan for you. I've said that all month long as we talk about some of these specific mental health related disorders. Have a solid treatment team, develop a good treatment plan in order to get you into a better spot so that you can live better. As always, I'm Dr. Neil Ritchie. I'm here just trying to increase awareness, decrease the stigma, and hopefully encourage all of us in the journey of better living. So until next time, live well. Thank you for tuning in to this week's podcast. If you have questions or comments, please let us know. We'd like to hear from you. If you enjoy our podcast, please subscribe and you'll be notified of new content. You may also like to join our Facebook and Instagram pages. This week's podcast was brought to you by Better Living and Counseling Services. Better Living and Counseling Services collaborates with their clients to establish goals and identify solutions to help clients toward achieving greater life satisfaction. Better Living and Counseling Services is a telehealth practice providing counseling to Georgia residents. To learn more about Better Living and Counseling Services, visit them on the web at betterlivingandcounselingservices.com. As always, we want to remind you that the Better Living podcast is not a replacement for the counseling services of a licensed professional. Please join us next week as we learn to live better.